by Central Party Committee and Central Government, as well as the Provincial Committee. After a month of effort, we have made some achievement. As of 24 o'clock yesterday, we have reported a total of 1,577 cases, and 822 are discharged, and 44 death cases. And right now, there are 711 people still in hospital for treatment, and 56 suspected cases, all receiving medical care in designated hospitals. The containing of this disease has shown the following trend. First is the reduction of newly confirmed cases, which is down from 253 on the 12th. And right now we are registering a single-digit growth. And the number of suspect cases also continues to decrease from 785 to 56 of today. The number of critical cases is also decreasing. It has been reduced from 73 cases to 14 cases of today. The number of critical cases is reduced from 163 to 76 of today. The one increase refers to the number of discharged patients. As of yesterday, 822 patients have recovered and has been discharged. That is to say, half of all the confirmed cases have now healed and been discharged. We have, first of all, done a thorough screening of a total of 15 million households and more than 1.5 million households and more than 5 million population. And we have done categorized management of these population. And second, cut the emission of transmission. And since we kickstart the emergency response on January the 20th, we have locked down the major transport pathways, as well as suspended the vehicles and travel lines inside the city. We have also set up checkpoints in major access and roads. So the roads and communities are our priorities in order to control mobility. Third, to strengthen treatment, increase hospital wards so that it can surpass the growth speed of confirmed cases. And right now we have 44 designated hospitals, and the number of isolated wards has now been increased to more than 3,700 cases, so that all the confirmed cases and suspected cases can receive the treatment that they need. The very special thanks goes to the help given to us by Guangdong and Hainan medical teams, and altogether they've sent to us more than 800 medical professionals who have been taking over the weakest links in our endeavors, and they also bring with them the much-needed medical supplies and help us establish a long-term and long-distance online consulting mechanisms. Fourth, guarantee supplies and daily necessities so as to meet the need. We make endeavors to also ensure the daily necessity supplies of the people. Currently, the supply of the basic groceries can meet the demand of the people in our city. I'd like to take this opportunity to thank all of the Jingzhou residents for standing with us in overcoming difficulties and showing your support for our work in containing this disease. Your support and confidence is a strong backup for us. Currently, despite some of the achievement we've made, but overall speaking, we're still facing very complex situation in the city, and we have also a lot of shortcomings and gaps in prevention control. First, we still need to strengthen our efforts in screening and epidemiology studies, as well as the treatment of patients, especially that of the critical and severe cases. Many of these cases are elderly people that constitute difficulties for us. And third is, after the lockdown of the city for a month, there are a lot of problems concerning the convenience of people's life. And we're also encountered with a lot of contradictions in production as well as the containing of the epidemic. Coming up, we will continue to stay cool-headed and not relax before this war is finally over. We need to make sure that all the tasks are done according to plan. Our first priority is still treating the patients and save lives, so as to make sure that more patients can recover as soon as possible. We will be integrating the Destination Hospital into 24 so that we can mobilize the best resources to treat those that need them most, reduce the working pressure of the medical workers, and also make room for the treatment of other diseases. Second, to provide better life services to the residents, ensure the supplies, stabilize the price, and answer to the needs of the people. These are the 4 priorities in our work to make people's life more convenient. Is a priority also in containing of the disease. 3, to carry out a strict control at the main access in and out of the city. All of the people and cadres in our city need to make their own contribution to help us to get over with this this epidemic in our city and in this province and the country as a whole. Now let's give the floor to Mr. Huang Fei to talk about the efforts of Guangdong medical team. The provincial government of Guangdong is in great support of the prevention control work of the city of Jingzhou. We have sent out altogether 6 teams and more than 500 medical personnel to come to Jingzhou to their assistance. We maintain close contact and we are working effectively with our Hainan colleagues. We have taken over the most affected regions and hospitals, especially the severe cases. Currently, the confirmed cases in our city is decreasing for 5 days in a row, and all of the critical and severe cases are receiving medical care in the hospital, and their situations, from what I can tell, is improving as of now. In terms of decision, and we have to stabilize, we have to stay strong, and also to expedite the process. Stabilize means that we need to stabilize the main population. We have established several treatment centers, and we are in charge of 13 zones, and there are 36 deteriorated cases and 37 improved cases. The severe case rate has reduced from 4.06% to about 1%. So that is the pressure that we have to withstand. And Honghu district is the most affected region. And we send a team that accounts for 22% of the total number of medical team. Upon arrival, none of the patients in Honghu was discharged, but as of now, altogether 108 people have been discharged, and the number is still increasing. Third, we have expedited the major processes. First is the access to nucleic acid tests, and make sure that the patients can receive necessary and in-time screening and testing. Currently, the interval of diagnosis has been shortened by a large margin. The Guangdong medical team has done the following work. First, in terms of clinical practices, we carry out collective treatment of critical and severe cases. We will continue to advance the effort in the collective treatment of light syndrome cases. So in the past 24 days, we have done testing of more than 1,900 nucleic acid test samples, and all the stock samples have already been tested, during which we have finished the testing of the 4 categories of patients and people. We also have medical experts to work hand in hand with the CDC officials to carry out the study of the epidemic, as well as that of the epidemiology study. We also give suggestions on community-level control, and we have reached a consensus with the local government, and these measures have been effectively implemented. Coming up, we will continue with the 3 priorities: collective treatment, screening, as well as epidemiology study. We focus on the key areas, as well as the prevention and control in families and in businesses, and prioritize the monitoring of the 4 categories of people, and will be work alongside our Jingzhou colleagues in order to finally win this battle against the COVID-19 disease. Now let's give the floor to Dr. Zhao Jiannong from Hainan Medical Team. I will be briefing you on the working situation of Hainan Medical Team. On January the 3rd of the Lunar New Year, the first group of medical workers arrived at Jingzhou City. This is the first team outside the province to arrive at Jingzhou. As of now, altogether there are 7 medical teams that have already arrived, and altogether there are 283 people that constitute these 7 teams. First, several characteristics of our teams. First, we come here at an early stage. The first group of 149 people have arrived here. All of them are from 3A hospitals, and they're experts from the key disciplines, including CCM and respiratory discipline. At that time, we were facing very complex situation and chaotic admission and treatment. Not only do we have to help them to do training, but also we need to participate in treatment first time. Despite the difficulties in life, as well as the different difficulties in living habits, we are working in 8-hour shifts, wearing diapers and protective suits, and the shift can be as long as 13 hours and a half. Our efforts have helped the Jingzhou medical system to stabilize the situation. Second, altogether, we have 7 teams and 863 people that are conducting treatment, that are managing more than 1,600 beds, and altogether 2,700 patients are receiving cares, and more than 300 patients have been recovered. Despite the understaffed situation that we have in our province, we have sent more than 150 medical workers from public hospitals and 27 from private hospitals to come to Jingzhou's assistance. So the public hospitals and the private hospitals workers are working together in terms of the treatment. Fourth, in terms of donation, the Hainan province have donated 1,300 pieces of PPE and equipment. We also have transported 9 batches of daily necessities that amounts to more than 3,000 tons, among which 1,800 goes to Jingzhou City, and we still have more daily necessities to be transported to Jingzhou soon. Coming up, we will first of all work under the guidance of our governor and vice governor, and we have established a temporary party committee at Jingzhou, and 17 party committees have been formed in Jingzhou, headed by the medical experts, as well as party members, to play a leading role. Second, conduct a collective treatment to the patients. Scientific treatment is key to us, and we need to conduct our medical care in multiple ways, including online consult and experts rounds. A long-distance consult platform is important for us to connect the wisdom of the local medical forces, as well as the experts in our province and in the whole country, in order to reduce mortality rate and improve recovery rate. We also have established a negotiation system to discuss matters such as transferring of patients, information sharing, and logistic supplies. Fourth, we need to strengthen the protection of medical workers. We also help them to do physical examinations during shifts, in between shifts. We also encourage the medical workers by allowing them to be admitted to the Communist Party of China at the front line. We also work to help support their family members back home and help them with address the problems that they need, taking care of their children and elderly at home, give them the much-needed guarantee in life and the daily necessities that they need so that they can work in the front line carefree. We will be leading our team members to continue to act according to the instruction of the Central Party Committee and the state government, and to carry out scientific treatment, prevention, control in order to win this people's war in the end. Thank you. Now the floor is open to questions. Please identify yourself first. With Renmin Daily. Containing of the epidemic is a people's war, and the people are the witnesses and the people who experience it firsthand. So how would you mobilize the people's power to help us win this war, and what functions do the people play during this battle? Thank you. If you know the city of Jingzhou, you would understand that this is the town of fish and rice, but also a place with a lot of natural disasters. Floods used to be a great threat for us that bring us with a lot of pains and painful memories. It is during our fight with the floods that we forged the spirit of the fighting the floods in 1998. The people are what we rely on during all of these fights. On January the 2nd of the lunar calendar, the city government have proposed that we have to rely on people and mobilize the people's power in order to win this people's war led by the Communist Party of China. In the past month, the party members answered to the call, overcome the difficulties, and voluntarily stay at home to cut the transmission. Many residents also made general donations, and millions of volunteers sign up for these efforts. I once visited the storage of the Red Cross and have found that there are volunteers there trying to carry a lot of boxes and containers. And I asked one of the volunteers, and he told me that he was he worked in the motor cars maintenance factory, and there are a lot of ordinary people like this, which is an important guarantee for us to finish all the screening as well as transferring and treatment of the patients. There are a lot of difficulties that we have overcome under their help. And now we are seeing some momentum of improving. More than 800 medical workers, doctors, and more than 1,700 nurses are working at the front line day and night. The chest hospital, as the most important battlegrounds, in which we found 7 married couples that are working, such as Dr. Zhu Yishan. And on the day of the Chinese New Year, he rushed back to Wuhan from Jingzhou to work alongside. And Gan Ruyi from the Public Security Department rode a bicycle to go back to Wuhan. And this travel is as long as 200 kilometers. We also have medical workers, more than 800 medical workers from Guangdong and Hainan that rushed to our assistance. The public security officers also have forsaken their holidays to work alongside with us. We have a police officer that is of 58 years old that voluntarily signed up for the job at the designated hospitals. He said that my family, my child has grown up, and I do not have any family burden, so please allow me to go to the front line. We have another officer named Xu Peng that undertook the task to pick up 2 medical workers. He drove for 3 hours to drop off the medical workers and continue with his efforts after he came back. We also have more than 30,000 party members that are working in the front line in all corners of the city. We have divided the city into 13,000 living units, and in these units, these cadres are safeguarding the safety and also helping the residents with the daily purchase of grocery and medicines. They are wearing the most simple protections. Many of them are wearing raincoats for protection so as to conduct their work at the grassroots. In the Zhongzhou village, we have a secretary called the Ma Chengwu and the Dong Li Hui. Both of them have lost their lives due to long working hours and fatigue at work. It is in our belief that with the synergy we have formed and with the endeavors and support of the people and residents in our city, we will finally be able to win this battle.
我是南方日报南方家记者。我们了解到，广东支援湖北荆州医疗队把核酸检测
The medical team of Guangdong have used the nucleic acid test as the breakthrough point and have established 2 medical centers. And what kind of considerations do you have in doing this kind of efforts?
非常感谢你对广东支援荆州医疗队的关注。
Thank you for your interest in our medical team. This is our priority, as you mentioned. In terms of the treatment of critical cases, on February the 14th, upon arrival of the Guangdong medical team, we began to deploy these medical records in the designated hospitals, during which we race against time to strengthen the treatment of critical and severe cases, during which we found that there are a large number of critical cases and severe cases, so collective treatment is highly necessary. That's why we have speedily reached a consensus with the local government, and we have established 2 treatment centers in the 2 designated hospitals that is delegated to treat severe and critical cases. In order to conduct collective treatment. In this process, we have been greatly supported from Guangdong province. Experts were sent to head these 2 departments, and top-notch teams have been formed in order to strengthen the treatment. Currently, the fatality rate of the severe and critical cases have been curbed, and recovery rate is increasing. That means that these 2 centers are playing this dual function. Second is the strengthening of a nucleic acid test. Before our arrival, we have done a thorough investigation of the local situation. Upon arrival, we have made consensus to improve the nucleic acid test capacity in county level, township level, and village level, so that these medical institutions can have access to enough nucleic acid test kits. Through speedy action, we also need to strengthen efforts in training and qualification. So I also want to thank the support of the local government for the speedy approval of all levels. Right now, most of the localities have access and qualification to do nucleic acid test. And the same efforts have been made to the identification of confirmed cases, screening at fever clinic and screening, as well as the screening of close contacts. The improvement of nucleic acid test has been expedited the screening process. And the above mentioned are some of the problems we have addressed after the improvement of the capacity. So, can you tell us more about the team formation of Hainan Medical Team? So, what are the considerations of forming such a team? And what do the Hainan Medical Forces do? And what kind of treatment did you do during your efforts in helping Jingzhou? In terms of the formation of our team, we gathered the teams according to the situation. We arrived here on January the 3rd of the lunar calendar. At that time, there are a lot of critical cases in Jingzhou. So the first group of people, for 149 people, most of them are in CCM and emergency room, and help them with a lot of the handling of a lot of critical cases, which help containing the epidemic in an early stage. And second team arrived on February the 14th. Our tasks have been transformed into treating light syndrome and general cases. So, and our second team most of the team members are working at the ER or TCM or the other internal medicine departments. So we do this based on the status quo of the city of Jingzhou. Altogether, we have 274 members working here, and which is from the current situation is suffice to meet the demand. We also have established a 3-tier treatment system. Tier 1 would be the medical teams at the hospitals, and their priority is the treatment of critical and severe cases, as well as the monitor of the indicators of the light syndrome cases, so as to prevent these cases from deteriorating. Tier 2 is the team of experts who will be doing rounds in the designated hospitals and do consult to address the most difficult medical problems in treatment. And Tier 3 is the team of experts in treating the cases with chronic diseases with them. This would involve an online consult platform that connect the local hospitals with other hospitals at home. So this three-tier system is aimed at improving the improvement rate and reduce fatality rate.
你好，我是长江鱼的记者，想问一下从网上得知荆州首例新冠肺炎的患者是由胸科医院。
The first case in Jingzhou was admitted to Chest Hospital and was also the first case to be discharged. So what kind of experiences do you have during the treatment of this special case? The first case in Jingzhou was confirmed on January the 7th, and this patient was quarantined and admitted to hospital for treatment. And after 20 days of treatment, this severe case was discharged. Looking back to the treatment process, there were two insights I'd like to share. First, early detection, isolation, report, and treatment is crucial. These are the most original prevention measure, and as of now, we are identified this as the most effective methods. Early identification, report, and isolation can help us to identify the source of infection and to cut the path of transmission. Early reporting and treatment can mobilize social powers to help with this endeavor and also prevent the deterioration of the cases. Currently, we have sufficient beds to spare, so that will give us more room to maneuver in terms of the screening and admission of the patients. Second insight, we have to strengthen the psychological support. Once the patients were admitted in isolated wards, anxiety and panic will occur, which will constitute negative impact on the patients. That's why we have to do consolation, encouragement, and help the patient to establish confidence. Especially if we found patients with negative emotions and passive emotions, we have to send experts, psychological experts, to carry out intervention. The first discharged patient, when facing the media, said that after getting this pneumonia, you don't have to be afraid. Just listen to your doctors and trust them. I think this can reflect that psychological intervention is of crucial importance. With Legal Daily, academician Zhong Nanshan and other experts have conducted online consult with the Guangdong medical team. So, how do you strengthen efforts in this regard? We are racing against time and fighting against this virus. And every minute and every second counts. We apply the same standard both in and out of our home so as to give the high standard medical services to Jingzhou people. Besides, the NHC issued a treatment plan, right now it's 6th edition. We also make use of the brochure that's issued by Guangdong expert. And it has been widely applied in Jingzhou. We have two critical medical centers, both headed by provincial experts from Guangdong Renmin Hospitals. Mr. Jiang Wenxin and Mr. Huang Daozheng. And the nursing teams are also from the medical teams of Guangdong. They are from academician Zhou Nanshan's team and other team of other experts. So we remain close contact with each other. We have also transported medical equipment to Jingzhou and a long-distance medical equipment so as to facilitate online consult and treatment. On the 23rd, we did another round of online consult, and academician Zhou Nanshan helped us with the consult of 2 key cases in which these 2 systems and equipment were used. We work closely with the local teams as well as the home teams to conduct consult on a daily basis and report the critical cases so as to realize individualized treatment of the severe cases.
湖北日报记者提问：前不久，支援湖北海南医疗队队员陈景王突发大脑动脉瘤。
Dr. Chen Jingwang have suffered from aneurysm breaks. During work, and which has made people very concerned about the safety and working situation of Hainan medical team. Can you tell us more about that situation? Thank you so much for your interest in Dr. Chen Jingwang's situation. Chen Jingwang is a young nurse of Hainan, and he signed up with his girlfriend together and also was included in a 3rd group of medical teams. And they were admitted and they are working at one of the mobile hospitals in Wuhan. He experienced some headaches during work. And the second syndrome appeared on the 21st, but he delayed his doctor's appointment due to busy work. We urged him to go to the hospitals and discovered was an aneurysm break. And after this incident, Premier Sun Chunlan and Governor Wang Hesheng visited him at the hospital. We also send neurosurgeons to help him do the surgery for him, and the recovery condition was quite good. On the second day after the surgery, an online consult was conducted by the top-notch experts. Academician Zhao Jizhong said something. He said that not only is Wuhan's medical team behind him, but the experts of the whole country is supporting him. When we visited Mr. Chen, the doctors in Union Hospital mentioned that he's here to help us and we will be treating him like our family members. So when we are talking to their families to his family at home, his father said that after recovery, he needs to stay in Hubei to do his work well. His story is an clear example that showcased the care to the medical workers in the front line and our comradeship between this camaraderie between our colleagues in Wuhan and in Hubei.
我们海南省援助湖北抗疫前线指挥部一直以来都非常关注我们抗疫医疗队。
The commanding center of Hubei's medical team of Hainan medical team in Hubei has been always following closely the condition of our medical workers. At the early stage, we asked to help mobilize the medical supplies and increase the supplies from multiple channels. Currently, we have sufficient medical supplies that can last for 10 to 15 days, which can give our medical workers enough protections so as to make sure that they can work in a safe environment. The local government also made efforts to help us to give sufficient supply in the daily lives. Our attention is now paid to the healthy working situation, make sure that they can have enough rest and they can work in shorter shifts so that they can have a great condition psychologically and physically. With CMG and CCTV, Jingzhou as a big city in farming and the agricultural productivity in Jingzhou is crucial to the economic development and the development of the whole province. So how would you balance the containing efforts as well as the agricultural production? The migrant workers were one of the most effective groups during this epidemic. So improve the agricultural activities and productivity is crucial to the economic development as well as the poverty alleviation effort in our city. Spring is the most important season in agriculture. Right now is spring seeding season, and it is important for us to conduct agricultural activities in a special time. Due to the impact of the epidemic, we are facing much more difficulties in the following aspects. First is supply, second is sale, third, labor, and fourth, technology. So we have been conducting the following measures. First, restore agricultural production in an orderly fashion. For the zero cases regions, counties, and villages, we have done yet another round of thorough screening so as to help them to prevent inward infection. And under such condition, they can lead the effort to restore agricultural activities. Also, we strengthen efforts in body temperature checks and disinfection of farming tools. We also have strengthened the effort in encouraging the agricultural businesses and enterprises to restore production under the condition of safety. Second is to increase supplies in agriculture. Currently, we are doing a village-based screening so as to have a clear picture of the demand of the farmers and organize supplies and deliver these materials in a non-contact fashion. As of now, we have restored 14 million tons of seeds and 1,800 tons of pesticides and 360,000 tons of chemical fertilizers, which accounts for 70% of the total demand. Third, to open up channels for marketing. Currently, the demand for vegetables, groceries, meat, fruits, and aqua products are in short supply, but in large demand. But this contradiction mainly happened because of this lockdown of the transportation channel. So we are strengthening efforts in connecting demand with supplies to strengthen procurement and delivery so as to expedite the sales of agricultural products. Fourth, strengthen efforts in animal husbandry as well as aqua product raising. We have done technological trainings online in order to guide agricultural activities and help with the mechanization in agriculture. Currently, our work on these fronts are advancing smoothly. I also want to stress that containing of the epidemic is still our first priority. Agricultural activities has to be done under the strategy of the city in terms of containing the epidemic. Thank you for participating. That's all for today's press conference.